Thank you all for joining us. It's noon, and we are just about ready to start our healthcare innovation trends from the trenches. And I'd like to welcome you for our 13th webinar in this series. Corey Smith, the Senior Director at Healthgrades, is my co-presenter today. And I'd like to tell you a little bit about us, why this webinar series, and why Corey. Today's webinar is all about what's going on in the world of marketing and how consumers are changing and how our approach has to change as well. I'm Andy Simon. I'm a corporate anthropologist and president of Simon Associates Management Consultants. About a third of our clients are healthcare, and we're very deep into the inbound marketing world as it's developing. Whereas Healthgrades involved in several of our clients, and we are HubSpot partners, and we've been CPM users over the years, and the toolkit is really changing as we're approaching a changing consumer. Corey Smith, who's going to be my co-presenter, is a senior director at Healthgrades. Corey has over 20 years of experience in the healthcare industry. He has a particular focus on solving problems for hospitals. He's held various leadership roles in sales and marketing, corporate accounts, and R&D. And he's been working with Healthgrades in a sales leadership role, assisting hospitals improving their quality of care to drive profitable growth and maximize physician alignment, and particularly to enhance hospitals' relationship with their patients. So that's what we're going to be doing today. I've gotten lots of questions from you and a wonderful audience to join us, so thank you so much. Healthcare innovation, trends for the trenches. A bit of context. When we began this, as an anthropologist, we were observing things going on in the field that were difficult to capture and share. And as I was talking to colleagues, they too were seeing things. When things are changing quickly, it's hard to capture them, to see what works, what's not working, and how to help others become more cognizant of this and comfortable with it. The idea of best practices has sort of gone out the window, and people are trying to make up what those best practices are as we're going along. So it seemed to be a good time to share these. One of the things that we know is that everything is changing. And we found this it was both amusing and very interesting. A physician not long ago was walking past us and grumbling. And when I asked him what was bothering him, he said, I really don't know what to do with my patient. He has a very large deductible, and he won't go for the x-rays or the tests that I'm recommending. And he shook his head. He said, instead, he's going online to research what I'm telling him. And we both sort of smiled and laughed, but at the other hand, he was really struggling with, what do I do? Am I not the purveyor of the truth anymore? This was another situation. A lovely lady we knew had gone in for surgery for her knee, but the surgeon she had didn't do a good job. And so she went online to find another surgeon. She didn't go back to her primary care doctor to ask his advice. She went to take care of this on her own. So what did she tell us? She went looking for a doctor that specialized in the type of surgery she needed. He scoped out his background. He came from a very fine institution. She researched his scores on Healthgrades and other places where she could see his infection rates and how many of these he had done. And then when she was all done, she made the appointment and went. And when he asked her how she had come to him without a referral doctor on her chart, she told him. He was both shocked and delighted, and a little amused and a little perplexed. And the whole thing is sort of setting the stage for what we're doing today. One of the things that in our own qualitative research with patients of healthcare systems and physician groups is a loss of trust. Patients said to us, can I trust this doctor? Is the doctor advising me as to what's best for me or what's best for them? I have a larger deductible now. Some of them had very large deductibles. I'm going to shop around and decide how I'm going to spend the money. And if I don't pay attention to their advertising, how will I know what to do? Will I listen to others? I'm going to find out for myself. This was from the Deloitte Consulting Healthcare Solutions, and I like the chart to share with you. Because what's happening is that people are changing how they find answers to their questions, build trust, and make decisions. Look at the first one. The seniors, 70% of them are looking at scorecards or report cards, but 26% of the millennials are. And even the Gen Xs and the boomers are right up there. Same process, asked about pricing before agreeing to a treatment. Those millennials are pushing the envelope. and looking for online information about a physician, of the cost or prices of a service, same kind of trend. Then here's what I really liked was this research on the millennials that was in marketing charts. The millennials trust in various forms of media. Just take a look at what they really trust: the product, the brand conversations with friends and family, peer reviews, opinions. Somebody said to me that when they need to know something, they go to Reddit and see what's going on there. They go to their favorite blogger and see what they're writing about. Professional and industry reviews, email, text, G-chat with friends and family, social networking and content, whether it's Facebook, Instagram, LinkedIn, product info and product buys from the company's website, and then it drops off. The print magazines, online, all the old media are really no longer the trust factors in how people are communicating with each other. And I think that the adage that it's not what you say about you, it's what they say about you is becoming very much alive. From a healthcare marketer's job, the trust factor is really what we're focused on. The question really is, who is it that we're talking to? What is it they want? How do we build loyalty? How are we building trust? How do we remain the honest solution for their problem? The power of inbound marketing, part of the reason we became HubSpot partners is that it was a very compelling model. We're not going to talk much about it today, but there are lots of different companies out there. In fact, some of you had signed up for this who are competitors of HubSpot, and often we decide who we use for different clients. But the power of inbound marketing is to capture those who are searching for answers, different ways to do it, to provide them with the best answers, information, and education to their questions in the simplest and easiest manner, and to become their guiding force to make decisions that are right for them and ultimately right for you. So it's no longer what you say about you, but what they say about you. And this becomes extremely important as people are trying to figure out what is it that's going on and how do I do this. So let me turn this over to Corey. And let me give him control of the keyboard and the mouse. And you have it, Corey. And let me tell you that we'll come back at the end and we have some questions that you've asked us to discuss a little bit. But let's think about how this all ties together as the consumer is changing and the healthcare systems are changing and the methods for capturing that is changing. Corey, please go right ahead.
Andy, thank you. I appreciate the opportunity to be part of your Trends in the Trenches series. It's incredibly valuable. I've listened to most of them, and it's really an honor to be here, so thank you. I'm going to focus most of my time today on the first bullet that you see on the screen, which is related to the healthcare-specific inbound marketing. At the end of my presentation, I will touch on what's on the horizon and that is going to be woven into marketing plans of the future, as well as what your C-suites can be expecting from marketing in the future. And again, this is very oriented around the hospital marketing and hospital executives. So healthcare is going through a transition right now from a volume-based system to a value-based system. And they're right now, the way hospitals are getting reimbursed is very heavily focused on the amount of procedures that they do, and they desperately want more commercially insured patients because of the reimbursement rates that they get from those commercially insured patients. In the future, in the not too distant future, there's going to be a dramatic shift where the majority of the reimbursement is going to come from how healthy hospitals are able to keep their patients. One of the reasons that I put this up here is because at the end of the presentation, I'm going to talk about the role that marketing is going to be able to play in this transition while we're in this chasm that I refer to it as a chasm of this transition period. So inbound versus outbound marketing, one of the things I did is I pulled up some definitions of both. So inbound marketing is about creating and sharing content with the world by creating content specifically designed to appeal to your dream customers. Inbound attracts qualified prospects to your business and keeps them coming back for more. This is exactly what Healthgrades.com is all about. We attract commercially insured patients that are making a decision about which physician and which hospital they want their care performed in. Compared to outbound marketing, which is the traditional form of marketing where a company initiates the conversation and sends its message out to an audience, to get them engaged. Ironically, Healthgrades is a leader in this space as well. One of the companies that Healthgrades acquired about 3 years ago was CPM Marketing, and CPM Marketing was the pioneer in hospital CRM systems. And now that it's all under the Healthgrades umbrella, we really drive to help our customers maximize the value of both inbound marketing and outbound marketing. But again, for today, I'm going to focus on the inbound marketing specifically for hospitals. And there's really two types of customers or consumers in the market. Hospitals spend a lot of money on their website, and what that website does is it enables the loyalists to be able to come to their physicians and find information about their physicians. You can see the demographics of the general population that is oriented towards your website and who's categorized as this group of loyalists. And this is primarily the group of people who know that they're not going to question their doctors, they're going to take their physician referrals, and they're going to go to the doctors that their primary care tells them to go to. There is another growing segment of consumers that we refer to as the shoppers. And very few hospitals to date have invested to try to attract these shoppers. And the ones that have had phenomenal results. But one of the reasons why it's such a great audience to go after is, I'm showing you the demographics of the people that come to the Healthgrades site. And the key is, they are the people that are the ones making decisions for the health care of their family, which is predominantly the head female of the household. And you can see that they're predominantly commercially insured with a very high household income, and they're highly educated. They are the patients that hospitals want to come into their organizations. So when one of these shoppers has a need, it's going to start from one of two places. It's going to start from either conversations with their friends and family, or it's going to start with a referral. Now, everyone on the phone, my assumption is in healthcare in one way or another. And because of that, we have a luxury. The luxury that we can enjoy is, if there is someone in our family or ourselves that has a healthcare need, we know the people that we can call to find out the right doctor to solve our problem. The average consumer does not have that luxury. The average consumer has to rely on their physician referral to get the first one and to get the diagnosis, but then is going to turn to their friends and family, coworkers, and social media to validate that that is the right doctor to go to, and in most cases gets a different doctor. And so now they have two names of physicians that can solve their problem. And now the next thing that they do is they go online to start to do research associated to which doctor they should go to. One of the studies that we had done suggests that 59% of the population rates physician rating sites as somewhat important or very important when choosing a physician. So they are coming to Healthgrades or a site like Healthgrades to research the physician, to help them get comfortable that that's the right physician for them to solve their problem or their family's problem. An interesting thing about going online is there is a huge growth associated to mobile devices. And 52% of smartphone users have looked up health information or medical information. One of the interesting things that we have seen at Healthgrades is we launched our smartphone apps 12 months ago, and we've seen an incredible amount of usage associated to that. 30% of our population is leveraging the mobile device as their primary research tool. And then the last mobile device stat I'll give you is 24% of consumers are more likely to schedule an appointment if some research is done on a mobile device. So for this group, the shoppers, they are becoming more and more empowered than ever. And again, one of the proof points of that was the Deloitte information that Andy showed at the beginning of the presentation, where the millennials are relying more and more on being a shopper and making sure that they're making the right choices. And part of the reason that that's happening is because there is more and more information that's available to the general public. In a little bit, I'm going to talk about what used to be available and what's available now, and it's dramatically different. It is shifting dramatically. And because of that transparency, we're actually creating a different type of patient because we're putting them at the center of the decision-making process. We're enabling them, because of that transparency, to be able to make the best decision for their health and their family's health. And social media is playing a huge role in that. There was a study done that suggests that 40% of consumers are informed or influenced by social media when choosing a physician. And because all of these reasons, the large health systems are trying to create environments where you're allowing the consumer to shop and navigate their healthcare system. And if you haven't started thinking about that, that's definitely one of the takeaways I would suggest you get from this, is start to think about how to help your consumer shop for your physicians. Because where they're shopping now, where those shoppers are shopping now, is predominantly Healthgrades. You know, there's a couple of other sites that are physician directories. And what I tried to do is create the bubbles in the size of the amount of people that are coming to those sites for information. You know, the goal of partnering with one of these companies, be it Healthgrades or one of our competitors, is you want to make your doctors more relevant to the consumers. And by doing that, you're going to see a lift in the commercially insured patients that come into your organizations. Prior to 2015, 2014, Healthgrades averaged 1 million visitors a day to our site who are researching, selecting physicians. Since January 1st, it's actually spiked up to 1.5 million visitors a day, and it's growing. So this group of shoppers, as a population or as a segment that you should focus on, I can tell you just from a Healthgrades perspective, has grown 20% year over year for the last 4 years, and we're anticipating it to actually accelerate for the next 3 years. One thing I'd like to mention is that when you partner with an inbound marketing company, it complements your site. So if you think in terms of the loyalist and the shoppers, when the loyalist searches for a cardiologist in Hackensack, New Jersey, they're going to find Hackensack's website, and they're going to go look for their cardiologist on Hackensack's website. When they're shopping, they're going to click on a different site, and in most cases, they're going to be coming to the Healthgrades site to find that cardiologist. Having a presence in both of those arenas is where your inbound and your outbound marketing are going to be able to start to complement each other. So the purpose of the Healthgrades site, when the visitor comes, quarter of the people that come to the site are looking for one physician. 3/4 of the people that come to the site are looking at multiple physicians, and they're shopping. Now, out of all the people that are coming, 54% schedule an appointment. Out of the 54%, almost all of them schedule an appointment within the same week. And for those 95%, 38% of them actually schedule the appointment in the same day. So enabling your inbound marketing partner to allow for scheduling is going to make that experience for the consumer who makes a decision to go with your physician as positive as it possibly can be. So now let me go back to the information that was available to the consumer before the internet. And it was really making a phone call to the doctor's office to find out if your insurance is accepted, make sure that look in the phone book to make sure that the doctor is located close by, and calling them to find out what their availability is. You know, at Healthgrades, we call this information your base profile. Like this is the blocking and the tackling that you have to make available to any consumer in order to select a physician to make an appointment. And what we have found is when they have that base profile information, when they have the basics, a consumer is 33% likely to make an appointment with that particular doctor. What we have found is, and we've been doing research for many years to figure out how we can increase that, what is the most important information to the consumer that's going to drive them to make appointments with those physicians. And what we have found is, if you complete their profile, that percentage of likelihood to make an appointment with that doctor jumps to 79%. And the three key things that go into completing that profile are helping the consumer understand the experience the physician has in treating that condition or procedure. It's the quality of the outcomes associated to the hospital that the physician operates in, and what is the patient satisfaction ratings from the other consumers, other patients that that doctor has seen. And if you make this information readily available to the consumer, 79% likely to make an appointment with that physician. And this is based on research that Healthgrades has done around the consumer. One of the things that we also did is we also reached out to the physician, because there is another segment of the population that comes to Healthgrades to look for physician referrals, and it's primary care physicians. Primary care physicians, some of them come to our site to look for a specialist to refer their patients to. And we went out and we researched the physicians and asked them, what's most important to you if you are about to refer a patient to another doctor? And if you take the base profile out and you take availability out, it's essentially the same things that the consumer has said. It's what is the experience that that physician has both in treating and the amount that they have been treating that condition, what is the outcome associated to the quality, and the patient satisfaction scores of that particular physician. You know, through our research, we've found that there is a high correlation in the experience that a doctor has in treating a condition or doing a procedure with the quality of the outcome. And I'm going to walk you through an example. So the example is, your mother needs to have her hip replaced. And you've talked to families and friends, you've got a physician referral from the primary care, and you've got 3 doctors that you've been told your mother should go to get her hip replaced. And as you start to research these physicians, you're going to find out that the frequency to which they operate on the specific specialties varies from doctor to doctor. So in this case, you can see that Dr. 1 is highly focused on doing knee surgeries. Dr. 2 is focused on hips, and Dr. 3 is focused on spines. And when you look at the mix for each of the doctors as to the concentration of the specialties to which they perform, if you were head of the household and you were making the decision for which doctor your mother was going to go have her hip done, knowing that there's a high correlation to outcomes, you would want to make sure that your mother went to doctor number 2. And before the internet, before the transparency, before the information that was available, you had to rely on whether or not they took your insurance, whether or not they were available, and how close to the house they were. But now you're able to say, I want to make sure my mother has the best quality of life moving forward, and I'm going to send her to doctor number 2. Now, shifting gears to patient satisfaction. What we have found is that there's actually very little variability in patient satisfaction. And there's virtually no 2s and no 3s. The majority of the patient satisfaction scores are a 1, a 4, or a 5. And what happens is, for the 18% that had a bad experience and they're very upset, they're going to go out and put a 1. As long as they don't have a bad experience, they're going to go in and they're going to put a 4 and a 5. And what's interesting is, it's almost like the consumer is validating their choice that they made in the care that they selected. And so, I mean, the irony is that it doesn't have a high correlation to the quality of the outcomes, ironically. So when the consumer comes to Healthgrades, What we're really trying to drive them to is the right doctor, the right hospital, and the right care. And in that hip example, if you came and you did a search for orthopedic in the Denver market, you'd see that there are 642 orthopedic surgeons. And then if you filtered on the ones that just perform hip replacements, it would be reduced down to 301. And then if you focused on the number of orthopedists who perform the majority of the hip replacements in Denver, you would see that that number drops significantly down to 57. And then out of those 57, if you correlated it back to the ones that operated at a 5-star hospital, you would see that it goes down to 9. And then out of the 9, you would look to see which one had a 5-star patient satisfaction rating. And at that point, you have found the right doctor at the right hospital for the right care. And that's the experience that Healthgrades is creating for the consumers, for those shoppers that are coming to our site. So related to inbound marketing, by partnering with Healthgrades or a company like Healthgrades, I'm going to say it again, your goal would be to make your physicians more relevant to the consumer so that they're enabled to make the best possible choice for their care. What we have seen is for the hospitals that have partnered with us to make their physicians more relevant, there has been a 30% lift on the number of individuals that are looking at their physicians. And again, when you think about that in the context of the majority of them are commercially insured that are on our site, they are the right people coming to look at your physicians. When you go out and you talk to Healthgrades or a company like Healthgrades, the second thing I'd suggest that you do is really understand the value that those partners can create for you and dive into it and compare it to make the best choice for your organization. And then after you make that choice, start to measurably convert that patient demand into physician encounters. Now, when you've got that strong inbound strategy, just remember you're pulling those consumers in that are raising their hand, and it absolutely marries your outbound strategy where you're communicating to say, make sure you're considering my hospital, make sure you're considering my doctors. And for the partners that we have that have maximized their inbound and outbound strategies and developed them together, the results that they've seen have been demonstrable. Now, related to, I'm going to shift now and talk a little bit about outbound marketing. I had mentioned at the beginning that, Healthgrades acquired CPM Marketing, and because of that, we're a leader in the CRM space. There's really 3 key things that are really important as we move into the future. And if you remember back to the volume to value shift, what's going to be really important for your CRM to do, if you have one or you're thinking about getting one in the future, is make sure that it has predictive models. Make sure that your CRM is able to tell you with a high degree of confidence who in your population is at high risk for hundreds of different disease states, so that you can, number 2, have communication campaigns specifically targeting those people, both online and offline. And then the last item, where you're measuring everything, because you're going to need to be able to prove your value to the C-suite. Now, related to the future, the marketing plans of the future are really going to have 3 key aspects. It's going to have that inbound strategy, outbound strategy, but they're also going to have the population health strategy. And the reason that I bring that up is, again, over the next 3 to 5 years, we're going to be transitioning to a value-based system where the majority of the revenue for your hospitals are going to be coming from how healthy you keep your population. And if you remember what I just talked about related to the CRM, your CRM is going to be able to identify in your population who is at risk of getting sick. So if your population health strategy is keeping the healthy healthy, and the graph you see is the Pareto law, right? The 80-20 rule, where 80% is healthy. You've got 20% that are sick. You got 19% of those that are probably in some sort of case management solution with your hospital with some chronic care. and then you got the highly complex 1%, and you can see the cost structure down at the bottom. What your CRM should be able to do for you, or will be able to do for you, is identify in the healthy population who's at high risk of becoming sick in the future. And where it gets really interesting is the CRM should be able to start to communicate on behalf of the physician with those patients in a bidirectional fashion to curb their behavior to keep them healthy and keep them out of the sick 20%. And this is what's really exciting to me, because this is right on the forefront of where the industry is going. Now, with that said, the last slide I've got is really what your C-suite should expect. And I can't stress the first point enough. As we shift from a volume-based system to a value-based system, marketing is a strategic asset for every hospital to make that shift as smooth and easy and as profitable for the hospitals as possible. Your inbound and outbound marketing is always going to be there to attract the right patients. The population health strategy through your CRM is really to keep the healthy healthy. And then the last point is marketing is going to be incredibly accountable, because everything's going to be measured. Every dollar invested in marketing, there should be an ROI associated to that, and having that CRM tool and the inbound marketing strategies with those partners are going to be able to share that information with the C-suite. And Andy, with that was my last slide.
And I'm back. And Corey, that was absolutely wonderful. Let me first summarize a little bit and then articulate some of the questions that you had sent to me in advance that we can answer. And one of the big ones is about ROI. A story to share. I started with some stories. One of our clients in one of the areas, as we were digging into the Healthgrades data, in 2013, I believe it was, had 734,000 people searching for a doctor. And it was just a staggering number. But the most powerful part was that 34% got an appointment, and you could begin to actually measure those who got the appointment and over what period of their experience with that physician they ended up inside the hospital. I share that with you because what now has become is a new strategy for thinking about the role of marketing, inbound marketing, and the tools to use, because the finance folks can now actually take the data from what came in and see what actually happened and calculate an ROI on that investment. It's far more of a business investment than it is a fluffy marketing dollar that was difficult or intangible to calculate. It's no longer even about a brand equity index. It's really about who searched for us, how many did we capture, and over the lifespan of their relationship with us, can we measure the ROI, and how does it change over time? This means that we need to have a new belief across an organization in the power of the consumer and their ability to search, to seek and find solutions. And as I started, I told you about the doctor who was incredible, but maybe it's time for those physicians to become far more aware and cognizant of the fact that their patients aren't the way they used to be, and loyal they may be, but they also often have children and grandchildren who are now shopping for them for those decisions. So the times are changing, and can we change them as well? I'll tell you about the next one in a second, the questions that came through. The first one is on the ROI question. When David Marlowe did his talk, his webinar in November, he was talking about the challenges of calculating ROI on what I'll call the more traditional marketing and advertising that was being done. Corey, can I ask you to talk to our audience today a little bit more about how ROI is calculated for an inbound marketing experience like this? And I can talk a little bit about HubSpot as well. Would you like to share?
Yeah, I'd be happy to. So what's interesting is because of the nature of the internet, we're able to measure everything. And we have a saying at Healthgrades, new. And what I mean by that is the consumer clicks on a button that says, I'm a new patient to this provider. And so they self-identify as a new patient. They get onto the call center, and the first thing that the person asks them is, "Are you new to the provider?" And they confirm yes. After that, we then marry up the data to make sure that that particular patient has not been in the hospital system in the last 2 years, and verifying that it is a new patient. Healthgrades' ROI model for our partners is oriented around driving new patient volume, and we focus on the news. Some of the indicators of where you're going to see that value, because we're able to measure the contribution margin for every one of those new patients that come through the site to the hospital, is you're going to see it in the payer mix of the difference between the payer mix that comes through Healthgrades compared to the payer mix that the hospital sees generally. We've seen a 30% lift in the searches that happen for the hospital's profiles, as well as a 30% lift in the call transfers that happen for the physicians that participate. And what's interesting to me is, as big as all of those ROI numbers are for our customers, they're actually conservative. And the reason that they're conservative is, when a consumer comes to our site, they don't have to click on the button that's going to connect them to our call center. There are some that can drill into the site, find the doctor's office phone number, and call direct. And we're never going to be able to measure those through our BI tools, our business intelligence tools. So we know that there are some that are coming to our site, finding the phone number, and calling direct. And then the second thing is, through the call center, we have about a 76% demographic capture rate, which means that there is about a quarter of the new patients that are coming through that don't feel comfortable giving the demographic information to the call center, at which point we can't report off of those patients when they go through and have their encounters. So the numbers that we typically see at our hospitals is a 25% reduction. But Andy,
That's okay. The second question, I want to go back to that chart about the loyal and the shoppers, because when you showed the Hackensack illustration, if I were a loyal, and one of the things that we've learned is that once you are a patient or a customer, how does an institution delight you? And so while we've talked here a lot about those shoppers and those two illustrations at the beginning where people now searching for solutions, but your own patients are going to be doing the same. So what we are learning is, how do we, in fact, delight them? How are we demonstrating, affirming, as Corey mentioned, that their choice was the wise one? Because if you didn't come up right there, then maybe the doctor that I do have isn't as good as I thought they were. And delight can come in a lot of ways. If you look at the population health model, what are the ongoing resources, education, information, and services that you're going to be able to provide, both on an inbound and an outbound basis? So somebody newly diagnosed with diabetes, for example, will probably go on and search to find out what the latest is, who the best are, and where they are. And if you don't come up, then you may not be in that spectrum of the best of the rest that your own loyal patients are expecting you to be in. So I wanted to balance the shopper with the loyal and make it not seem as we're only searching for new patients, but we are really here to delight those who have been with us for a while. There's one question I want to talk to Corey a little bit about, and that's type of people inside an organization in terms of training or expertise. Somebody emailed us and said, how do you find the right folks who can begin to think in an inbound marketing way? Do you have some thoughts on that, sir?
I do. So it's not just the marketing department within the hospital. It's the business development department within the hospitals that typically are the ones that Healthgrades usually focuses on first. You know, the ideal audience for someone from Healthgrades to have at a hospital to make it as meaningful as possible is to have the CFO in the room so that they can validate the numbers and understand the ROI associated to it. It's the business development leaders so that they can understand the value of the patients that it's going to drive into the organization. And Andy, to your point, not only the new patients, but also the loyalists that choose to come in through Healthgrades also, which is significant. And then also from a marketing perspective, whoever the leader is of marketing, so that they can make it part of their plan or have it be a part of the solution.
Now, my last question, and then we'll wrap for the day, is what about physicians? Our very first webinar was by Chris Barlow, and she spoke about physician liaisons. And she and I have been in conversations about how, as more and more doctors are employed, what's the role of physician liaisons in this whole process? And I know, Corey, when we were talking about launching in one healthcare situation, getting out into and explaining this becomes extraordinarily important. You want to share some of your experience?
Be happy to. So from a physician liaison perspective, when you partner with a company like Healthgrades, we're going to be able to arm those liaisons with reports that they're going to be able to review with with those physicians. That's indisputable data. So from a splitter perspective, it's highly valuable because the liaison is going to be able to sit down with the physician and say, listen, the hospital has made a significant investment in marketing your services, and we can see that last month 20 patients were driven to you through that marketing campaign that we've invested in you. Help me understand why only 2 of those patients came into the hospital. And what we have found through the hospitals that partner with us is that those physician liaisons that have those types of questions with real data in front of those physicians that are splitters, inevitably what comes to light is what the objection is from the physician as to why they're not sending more patients to your facility or one of your facilities. And it gives the liaison and your hospital the ability to address that objection because you've brought it to light, to be able to overcome it and delight that physician to be able to have him or her send more patients to your facility.
So this really is a shift in so many elements of what has been a well-established legacy in terms of relationships. In so many ways, though, it's the consumer that's driving it. And so with that, I want to talk about our next session because it's all about the consumer. And Steve Moglen from Franklin Street is going to be talking about today's patient. Are you ready for her? Steve's a wonderful speaker, and I think what you'll enjoy is it's a shift about, it's no more than high touch, high tech messages. She wants to book her next mammogram from her phone. And there was one physician who told me about her daughter in San Francisco who literally had an app on her phone, and she could find which doctor had an appointment when she wanted it and book it right on that phone. So that new consumer has a whole new set of expectations to be met if she's going to trust her and her family's health to you and your system. And his question is going to be, is your brand ready to win her over? So with no more questions, Corey and I want to thank you all for joining us today. Virtually everybody has stayed on for the whole webinar. It's been a terrific group of people. Corey and I both will engage you afterwards. So if you want to have more conversation, I give you my email and you can find my website, and I can certainly refer you over to Corey. Thanks again. Corey, thank you so very much. It's been a great pleasure. And I'm going to sign off now. Thank you, folks, and have a good day.